We will be going through the gastrointestinal tract.
Alright.
So this is your first scenario. So kindly read it and then we will start.
Alright.
So what is the normal esophageal lining?
Normal esophageal lining is stratified squamous epithelium, non-keratinized.
Okay, so after reading the scenario, what will be your most probable diagnosis?
Most probable diagnosis in this patient is esophageal cancer.
Okay. So what are the etiological factors of cancer esophagus in this patient?
Okay. In this patient, the etiological factors are smoking, history of jet. Yes, smoking and history of jet. Okay, those are the etiological factors in this patient.
So what is the effect of prolonged gastroesophageal reflux disease?
Okay, its effect is metaplasia, dysplasia, and subsequent Barrett esophagus, whereby the normal esophageal line of stratified squamous epithelium will be turned to columnar gastric line epithelium. So Barrett.
Okay, so which test will you perform in this patient to reach your diagnosis?
Okay, in this question, I'll do esophagogastroradioscopy and biopsy to take tissue that I will do histological analysis that will give me the diagnosis of presence of cancer cells.
Okay, so what information the obtained cells will tell you about?
Okay, when I obtain the cells, the cells, I will see nuclear cells increase in nuclear cytoplasmic ratio. I'll see increase in um, nuclear chromatin, and then I'll also see increased mitotic figures. Those are features of cell malignancies. That is for the cell. For the tissue, I may see the situation in tissue architecture.
Okay, so what is the stain which is used in immunohistochemistry?
Kerato, well, I'll come back to this.
Okay, so the pathology report shows Barrett's esophagus. So can you tell me about the type of epithelium which is present in Barrett's esophagus specifically?
Okay, in Barrett esophagus, the type of epithelium is columnar. It's columnar epithelium.
And what specific type of cancer is associated with Barrett's esophagus?
Okay, Barrett esophagus is associated with adenocarcinoma.
Okay. So can you tell me about the treatment options which are available for esophageal cancer?
Treatment options available include if it is much early, much earlier, local and focal, very early, limited to the mucosal, patient can benefit for submucosal resection. This is when the cancer is seen, especially on surveillance already for other purposes under esophagogastrodiagnostic. Patient can benefit for submucosal resection. If it is maybe involve the mucosa, the submucosa T1 or T2, if it is not metastasized still within, patient can benefit for asparaginectomy. Yes, asparaginectomy. And if it is advanced, patient may benefit for palliation with chemotherapy only and supportive care.
So if in this patient, after 6 months, pleural effusion develops, what could be the possible reasons?
The possible reason could be tumor recurrence. It could be metastasis to the pleura. It could be metastasis to the low parenchyma.
Okay. So which pathological test you will perform to identify the reason for pleural effusion?
I'll do histology. I'll do cytology of the pleural fluid.
Okay, and how will you treat it?
The pleural effusion, I will treat it by application of chest tube to drain the neural effusion. Chest tube drain. Chest tube drain. I will do the chest tube drain. Then subsequently, I will do pleural dialysis to occlude the pleural cavity.
Okay. So in addition to pleural effusion, there is left-sided single supraclavicular lymph node enlargement. What test you will perform?
Okay, I'll do fine needle aspiration cytology of the supraclavicular lymph nodes, or I can also do excisional biopsy of the lymph node. I can extend it and subject it to biopsy.
Okay. So you perform the excisional biopsy, and what specific features you will observe under the microscope?
Okay, I'll see metastatic. If it is from metastasis, I'll see metastatic cells within the lymph nodes with adenocarcinomatous origin. That is the commonest tumor from the esophagus, and then some inflammatory areas and some inflammatory lymph nodes within the, some inflammatory cells within the lymph nodes as a reaction to the presence of cancer cells, but basically metastatic cancer cells from the esophagus. That's what I will see on the section of lymph nodes.
Okay. So you missed only on one question. That was the stain used for the immunohistochemistry.
Cardio, I think cyto, yes, cyto,
Cytokeratin.
okay, cytokeratin, cytokeratin. Yes, thank you, cytokeratin.